Befrienders worldwide and befrienders, because we are going to involve the public awareness regarding suicide. So, what are the services of befrienders? The services offered by befrienders are telephone helpline befriending, as what we did in Befrienders Johor Bahru. And we also have face-to-face befriending, email befriending, outreach to communities at high risk, crisis intervention, disasters response, and public education, as today we did too. Magnitude of suicide worldwide, 1 death every 40 seconds. If we count 1 to 40, there is 1 death. In Malaysia, we have 7 lives lost every day. What's the impact of suicide? Impact of suicide. Suicide affects individuals, families, and communities. For every 1 loss of life due to suicide, 20 attempted suicides, 200 family members traumatized, workplace affected, economy affected. Although sometimes we didn't come to this awareness, health services affected. In fact, it affects many areas. Suicide prevention is a collective responsibility. We need to involve all sectors of the community in suicide prevention at every stage. Suicides can be prevented. Incidence of suicides can be reduced. This message is very important. Suicides can be prevented. Promote responsible media reporting. This one is very important, as if there is positive news on the suicide rates is reduced, it's getting lower, and not to repeat the suicide story every time, not to increase the negativity. Then talk about the strategy. Strategy, the early detection and intervention, so that it's not too late to save a life. Inter-sector collaboration and networking, emotional support services, education, joint responsibility of community, as befrienders itself cannot do everything. Awareness through education need to involve all sectors of the community in suicide prevention efforts. Now, regarding reaching out to groups at high risk, who are the groups at high risk? They are the teenagers aged 16 to 20, and they are young adults aged 21 to 24, senior citizens aged 65 and above, and the plantation communities, native communities in Sabah and Sarawak. With this, we have networking partners, and who are they? They are Ministry of Health, Welfare Department, government agencies, colleges and schools, relevant NGOs, religious organizations, private sector, Psychology Associations of Malaysia, Mental Health Associations, Hospital Permai, and the Minda.